doses. And actually in Melbourne, they are trying to open up another safe injecting room, because there are a lot of individuals that are in the city, and they are injecting unsafely. But until this time, it hasn't been supported by the government, and also society. Well, the individuals within the city really don't want it, which is really, I think, sad, because it can actually help to solve a very difficult social issue. Not everyone is ready to stop using drugs, and that's why harm reduction really supports them, because we're not saying stop. What we're saying is to do it safely, and quite often in that area they will reduce taking drugs, and we can prevent death by overdose. Now, where are we here? Got it. Sorry. All right. So I am going to talk about medically supervised injecting rooms. So I'm just admitting somebody here, because it really is something that I've been involved in recently, and there is an amazing group of individuals that work in these to really support people, individuals that take drugs, but also providing them with a safe space. So they are hygienic, and you can administer drugs in a supervised health setting. The safe injecting rooms, they also provide other services, from doctors to dentistry to counsellors, nurses, and also a safe space. Once you've injected, you can actually go into a common area and have a coffee, tea, talk to other people, which provides them with an environment that is incredibly destigmatizing, and they feel more self-worth. This means that somebody overdoses in a room, a staff member can respond immediately, and what is the name of the drug? Naltoxone or something like that. I can't even remember now, sorry. Can be administered, and that reverses the drug, say the heroin that you're taking. North Richmond's medically supervised injecting room is the only one in Victoria, and outside of the injecting room, they do have a community response team that acts outside of it, and they really are there for people that, say, have been penalised for some time, that they can't go into the medically injecting rooms. There are a lot of issues in there, sometimes behaviour problems. So then these people can be supported outside. And they also provide services like taking community members to hospitals, to other support services, so that they can get good levels of support, and everybody's advocating for them as well. In the area, the Melbourne Safe Injecting Room, what they call it, is strongly debated. It's very much in contention with some of the business owners in the area, and also the community outside of it. But it is also understood that, there are less deaths in the area, and there's less probably people injecting in laneways and in people's houses. So some statistics about the Melbourne Safe Injecting Room. So this is from 30th of June 2018 to 30 September 2023. There have been 41,000 visits, which is quite remarkable. 3/4 of the people are male that present, and the average age is 43, which actually I was quite surprised about, but that fits the demographic. 1 in 6 of the people presenting there identify as First Nations people. 1 in 3 of these people are homeless or in unstable housing. There have been close to 7,800 overdoses, and not one of them has died, which these numbers are totally staggering. And it really is supporting the individuals, and it is supporting the families. Nobody wants to see their loved ones in a place where they could be unsafe overdosing outside of this service. More than 141 health and social support services have been provided, where it's down to dentistry, providing physical health support, because we know that with there are a lot of physical health conditions that quite often go with it, and also nearly up to 2,900 homeless support services. So they have been able to find homes for these people, because of course a lot of people that access these services are of course homeless. So staggering, remarkable and lovely statistics to see. So I am going to take you back, because I do have a couple of videos, and I really do hope that these work. And if they don't, I've got two trusted employees next to me who will help me out.
So
could you also put it on expand the screen, make it full?
Yeah.
Just the little thing in the bottom corner. Thank you.
Taxi! Harm reduction is common sense. It stops people from being injured and dying from things that are preventable. It saves lives, it saves money. It's smart. Here's a fact. Last year, 47,000 people died of drug overdoses in the United States. Because you're smart, you know these deaths are preventable. But here's something you may not know. Some kinds of prevention don't work.
Just say no. Who taught you how to do this? Any questions?
It's time to stop the drugs.
We've tried all these things, and still the number of people dying of overdoses continues to rise. But remember, you're smart. And because you're smart, you want to stop these preventable deaths. Do you know what is clinically proven to work? Harm reduction. You remember that, right? Harm reduction works for people who use drugs. It knows that people aren't perfect, but they deserve every opportunity to be as safe as possible. It encourages people to get educated and connected with healthcare. Harm reduction provides access to naloxone, the drug that reverses overdoses. It provides people with sterile supplies to prevent the spread of HIV and viral hepatitis. And when harm reduction is implemented in its most effective form, it gives people who use drugs access to supervised injection facilities in order to provide life-saving interventions in the event of an overdose. In 102 supervised injection facilities worldwide, there's yet to be a single fatal overdose. With more than 47,000 overdose deaths each year, what are you waiting for? Support safer, healthier communities by supporting supervised injection facilities in your city today. Learn more at www.harmreductionactioncenter.org.
Can everybody see that slide harm reduction video? Thank you very much. I hope you enjoyed that video. I'm also going to show you another one. Again, I apologize if there are other problems here. So Sonia, don't walk away.
Prevent recovery and healing. Jamie Favero started a needle exchange program in 2005. She's also the founder of Next Distro, an online and mail-based platform that provides people who use drugs with life-saving supplies, education, and support. Tonight, her brief but spectacular take on how we see addiction.
There's critics of harm reduction all over the country. The most common thing we hear as harm reductionists is that we're enabling people to use drugs. Research study upon research study has proven that what we're doing does not increase substance use. It actually facilitates people getting into care. I began an underground syringe exchange in 2005. I basically stood outside on a street corner at night handing out needles. It was great because people were able to keep themselves safe and healthy and well, and also it was an opportunity to talk to people openly about their drug use, about their struggles, about what they wanted for their future. And that became a legal needle exchange program in 2007. People are using someone else's syringe. They're taking one syringe and they're using it 20, 30 times. No one should be sharing needles. Sharing needles facilitates HIV and hepatitis C transmission, and there needs to be syringe access for people who use drugs so they can protect themselves against diseases. A needle exchange is a place where people can come not just to access clean syringes and injection equipment. That's a piece of it. That's a much bigger story. It's a place where you can access case management, linkage to care, advocacy. You can get referrals into drug treatment. We had a health clinic run by Columbia medical students. Syringe exchange and harm reduction programs are not just places where people get clean needles. They create an atmosphere and an environment where someone who uses drugs can talk openly about their drug use and their struggles. Maybe they're not interested in going into drug treatment that day, but they want to know about what their options are. We're going to provide that information without trying to pressure them into going into drug treatment. Working in harm reduction for almost 20 years, it's been really difficult to see the kinder and gentler way that the media has approached opioid use. Now that white people are dying, we're blaming the Sackler family. We're blaming Purdue Pharma. When black and brown people were dying of overdose, it was their fault. It was because they were immoral. The war on drugs has failed. And racialized drug policy is continuing to put poor people and black and brown people in prison for using drugs, while white people are seen as victims of a pharmaceutical industry. It's been very important to prioritize communities of color and communities who have been systematically shut out of healthcare systems to ensure that those folks are the ones that receive care and service. My name is Jamie Favero, and this is my brief but spectacular take on drug user health.
You can.
That was my presentation. Can everybody hear me okay? Excellent. Well, thank you very much also for working through the technical issues with me. Has anybody got any questions or things that they'd like to say? I know a lot of the community are supporting family members or friends with drug use. So if anything, I hope this has supported you to actually have an understanding, believe so strongly in these services, because I think for carers and consumers, their lives really can be saved and a better outcome. I do have one more video. Again, this one is from within the Melbourne Safe Injecting Room, and I think it's spectacular. So I will try again. So Sonia.
Was before the room was in place. It was in the midst of a drug injection epidemic. This building was purpose-built for that purpose, with that in mind, to try and make it a space where it could both function as a health clinic, so we could maximise the opportunities for health interventions, and also that it could be a safe space and one that people felt welcome to use. When somebody first comes into the room, they meet the people standing at the counter. If they indicate that they're planning to use the injecting room for the first time, we would ask them a number of questions to ensure that they're eligible to use the facility. We would then also invite them to share some information about their circumstances, their medical history, but that's all optional. People can also come in here just to access some of the health and social services that we have in the consulting area. So we ask everybody when they're coming in what they're planning to use today and what they've used in the last 24 hours. And that way we can get a sense of how to respond to any emergencies that might take place in the room. Then people will go through to the injecting zone. They'll collect any sterile injecting equipment that they need. They will sit down at one of the booths. If they come by themselves, they'll sit down at a single booth. If they come in with somebody else, they can sit down at a shared booth. And typically they will spend about 20 minutes in the injecting zone. They will inject themselves, but we can provide advice to them so that they do that in a way that's less harmful than it may have been otherwise. And then we keep an eye on them in case they overdose. And we have about 3 to 4 overdoses a day on average, in which case we need to revive people. Typically, if people have injected heroin, they're a little bit sleepy for a few minutes. Then when they're alert enough to stand up, they'll stand up and walk into the aftercare zone. If they want to, they can have a chat with some of the staff who are working here or use any of the other services that might be available. And now we've got an additional 3 rooms in which we can also make other services available. So we're working with homelessness services, mental health services, people who can use the room not just to inject but also to look after their health and social needs. Whether it's a GP, hepatitis nurse, drug treatment services, a lawyer, oral health services. Many people who are using the room, even though they're using the room to inject drugs, often want support to help them stop using drugs or to at least manage their drug use. So, to give an example, when we first opened, there was somebody who overdosed, and when we revived him, he got quite a shock and he thought, I really don't want to do this anymore. And he went straight in to see one of the doctors who was there, and he started methadone treatment that day. And then when we saw him a few weeks later, he told us what a difference that had made to his life. What we saw is that the people using the room had a high rates of untreated physical and mental health issues, and that they were open to receiving treatment, but they just hadn't been able to organise it. We really want to maximise the opportunity of the service to get people into drug dependence treatment, for example, because we think this will have the biggest long-term impact on drug use in the area.
Just asking, do you think the hospitals should have like a safe injecting space? What do you think?
What?
I mean,
we would love it.
Yeah.
But there's so much bureaucracy around this, and it's so, I suppose, from a layperson, it's so hard to understand why governments don't get behind these programs, because the outcomes can be so much better. But no, there's nothing like that.
Do you think is it the public stigma about it, or misinformation?
There's so much public stigma. Also, the bureaucracy within hospitals. A lot of them wouldn't want to get involved in that. They fear that it could turn patients away. Look, there's so much around this. That's a presentation within itself.
Yeah. Okay. Thank you.
Right. Well, has anybody got Carolyn Fleet? Thank you.
Thanks, Kate and team. Look, I just want to say I was in the session with Kate yesterday about the Richmond clinic and the injecting room, and I have learned more in the past 24 hours about harm reduction than I have in the past 3 years working in a lived experience role. So that education is absolutely vital. And I know I put in the chat earlier that it's helped me with the naysayers, and unfortunately I have a fairly large circle of people around me who are anti injecting rooms. And I feel completely armed now to be able to address that with statistics and proof and examples. And so, yeah, I think the education around it is absolutely vital for not only us as in the lived experience and the peers, but for the general public. And I understand why, the politicians and the hospitals, it's a controversial issue, and there's a lot of negativity around it. But I think, like a lot of other things, education, the more we can get the word out there about the benefits, I think the closer we're going to get to making this far less of a stigma situation.
Couldn't agree more. And thank you for those words.
I think I will just say that we know in Richmond, just through my work, that people were seeing overdoses in the neighbourhood anyway. Kids were seeing people overdose. So now, that it wasn't that the supervised injecting room brought those people. So in fact, there's probably children seeing less overdoses in the actual around the streets as much. I mean, there's still some that happens certainly, but perhaps to a lesser extent. So it's actually was there already, and perhaps also the school. There's a lot of work being done on the North Richmond Primary School to support those and that school nearby.
And as well, there, as Mary just said, there is a school next to the safe injecting room, but the principal is in favour of the safe injecting room and is working very closely with the team there. So,
can I ask a question? Because I'm very new to this space, obviously, but I'm really interested is there data, or I'm sure there has been, around the intersection of mental illness and substance use? So obviously it's fabulous to see that counsellors and doctors and others are available, but what would be the proportion of people with that combination?
it's about 80 to 95%.
Yeah, no surprises.
And working in dual diagnosis, they pretty much go hand in hand, which is unfortunate.
Yeah, thank you.
That's the reality of life.
Yeah,
but the dual diagnosis has the impact of almost pushing you out of both services. Often you get bumped around from both services.
Yeah.
We are within the services, we are looking at an integrated care approach, but of course, whilst that came in the latest Health and Wellbeing Act, it's still trying to be implemented. And of course, the staff haven't been educated in these areas either. In the UK, they treat it together, but here it's been treated separately, which is, so it's going to take some time for it to happen, to bring them together. Thank you.
Sorry, thank you, Kate. I'm by no means an expert in this area, but what I have found interesting in terms of the discussions around the locations of these injecting, or supervised injecting rooms. Obviously, there's a sense of not wanting it in my backyard, but some things that have really resonated in terms of what's happening in the Melbourne CBD right now is that they need to be where the injecting is actually occurring. So even these really well-meaning discussions around having them in the hospital, people saying, once you want to inject, it needs to be there. So the walk and the tram, 500, meters away, that's not going to help. So I think that just really, I suppose, around that kind of that location and that proximity need. Yeah.
Thank you, Laura. And I'm now, sorry, we can't take any more questions. We're nearly out of time. I'll hand over to Tessa and you can give us an update on the next members meeting. So thank you.
Thank you. Yes, I will just share my screen as well. So a couple of things that I wanted to say first, one second, is that thank you for everyone coming, especially those who are here for the first time. And huge thanks and round of applause for Kate for putting together such a sensational and important presentation that has really provoked a lot of interesting discussion today with his 26 minutes notice. So thank you for that. There are so many great resources in the chat and we will share them in e-news as well. So don't feel like you need to kind of rush through and copy all of the links. And I will just share my screen to talk about the upcoming meeting, because I do want to acknowledge that there are people who came here today to hear about the locals. Unfortunately, the presenter that we were going to have couldn't come to give that presentation, and so I do want to acknowledge that there will be people who are disappointed about that. Our April members meeting, which is on Wednesday the 24th, unlike our usual Thursdays, because the Thursday is Anzac Day, is going to be looking at how all of the services in the Geelong area, where we're going to hold the physical meeting, are working together to support families, carers and supporters. There will be a presenter who we have confirmed with from the mental health and wellbeing local there, who'll be able to answer questions, speak to what the locals are doing and answer people's questions. We're also going to have a few people from other locals available online so that if there are regional specific questions, we might be able to get them answered for you. So if you were hoping to hear about the locals today, do jump onto our events page. It's just tandemcarers.org.au/events and register to come along for that. I will update this page with the list of speakers so you can see who is there. And that will also include an opportunity to share about your experiences with the mental health and wellbeing locals as well, as we're very interested in doing some advocacy this year around sort of all of the new services that have popped up and making sure that they're doing what was promised that they would do, and that they're all actually working together as an integrated system instead of sort of a bunch of disintegrated services. So I will stop sharing. Sorry, that's stopping my video. I will stop sharing. And we're technically out of time, but if anybody has any questions about that or any questions about anything else, that we can hang around for a couple of minutes. But we are finished the formal presentation for anyone who needs to go.
Well, thank you, everybody. We really acknowledge everything that you do in supporting others who have, say, mental health, AOD issues. And it's great to always have you along to Tandem Time. And any questions, you can get in contact with us. You can call the support and referral line. And yes, we will see you again very soon.